Hello and welcome to In Case You Missed It, this week in healthcare policy and politics. Speaking of politics, we'll start there with a bipartisan House bill. Yes, I said it, bipartisan, still in the English language, could help employer health plans fight against facility fees. So there's two powerful House members that have brought back a bipartisan bill that didn't quite make it out in the last Congress. House Rules Committee Chairwoman Virginia Foxx, Republican, North Carolina, joined with Representative Robert Scott, a Democrat from Virginia, who is the highest ranking member on the highest ranking Democrat on the House Education and Workforce Committee, to introduce the Transparency in Billing Act. This is solving a problem that if you're in the space, you'll understand it. If you've had a bad bill, you'll get it. But there's something called the site of care cost problem. And what this bill would do would fight misleading hospital facility fees by requiring hospitals to use separate identifier codes when you're getting service at the main hospital versus an outpatient department. What has happened is hospitals are buying standalone facilities and charging the hospital price for these services out in these standalone facilities, doubling and tripling that billed amount to insurers, obviously trickling down to us paying more in our premiums and our deductibles. So this would be something that would fight those misleading hospital fees, and I am all for it. There's been recent pledges by the insurance industry that they will cut back on prior authorization requests. The AMA, American Medical Association, took a survey of their doctors, and to no surprise, only 33% of physicians surveyed by American Medical Association believe that the voluntary pledges would actually lead to any meaningful reduction in prior authorization requests. They cited the 2018 agreement where they all agreed together that they would work to find ways to streamline and reduce prior authorization requests, and none of it happened. So insurance companies don't have a lot of credibility with the AMA right now, and 2/3 of them don't buy what they're selling. The Centers for Medicare and Medicaid Services announced a 6-month nationwide moratorium on Medicare enrollment for hospices and home health agency. Also, no new ones starting up. Dr. Oz saying today we're shutting the door on fraud, preventing all these bad actors from fraudulently running up bills. There's been mixed response. The National Alliance for Care at Home swiftly criticized, saying there's no difference in this moratorium between the bad actors and the good ones, and it raises problems for people that need to access this care. Others were in support, saying they fully support rooting out the fraud, waste, and abuse and bringing credibility back to their business. This is all on the heels of the CMS suspending 447 hospices and 23 home health agencies in LA County earlier this year. Just hours after this announcement, CMS announces they're withholding $1.3 billion in Medicaid funds from California, saying JD Vance saying at a White House event that California has not taken fraud seriously enough. Dr. Oz, the CMS administrator, confirming this is the largest deferral ever made by the agency, with the goal of bringing the state officials to the table. Or is it to their knees? New York and Hawaii are next on their docket to research and withhold funds. Ever wonder what a strike costs a healthcare system? Well, you remember that strike at Kaiser about a month ago where they had 31,000 nurses and other employees not working for about a month? That cost them $1 billion in the first quarter. So you can see why they swiftly came to the table and got that fixed. Thanks for stopping by. See you next week.